a phase 3 trial of l-glutamine in sickle cell disease. Starting with the definition, the oxidative stress contributes to the complex pathophysiology of sickle cell disease. Oral therapy has been shown to increase the proportion of the reduced form of nicotinamide adenylonucleotides in sickle cell erythrocytes, which probably reduces oxidative stress and could result in fewer episodes of sickle cells related pain. Now there's a video.
Emmaus Life Sciences Incorporated announced that the New England Journal of Medicine has published the results of its Phase 3 clinical trial of Endari, l-glutamine oral powder, which supported the Food and Drug Administration approval in July 2017 to reduce the acute complications of sickle cell disease in adult and pediatric patients 5 years of age and older. Sickle cell disease is an inherited blood disorder characterized by the production of an altered form of hemoglobin. For more information, please contact Emmaus Life Sciences Incorporated. Brought to you by Atos Wire.
Now, how is it applied in medicine? This is a multi-center randomized placebo-controlled double-blind phase 3 trial in which is tested the efficacy of pharmaceutical-grade l-glutamine in the doses of 0.3 gram per kilogram of body weight per dose, administered twice daily by mouth as compared with placebo, in reducing the incidence of pain crisis among patients with sickle cell anemia or sickle beta thalassemia and a history of 2 or more pain crises during the previous year. Patients who were receiving hydroxyurea at a dose that had been stable for at least 3 months before screening continued that therapy through the 4-day-week treatment period. Now let's say a little bit about this.
Sickle cell disease is caused by a mutation in the beta-globin gene, which leads to abnormal hemoglobin polymerization and a cascade of events that ultimately results in vaso-occlusion and hemolytic anemia. Increased oxidative stress is thought to be one contributing factor to the disease process. Glutamine is an amino acid and antioxidant that may reduce oxidative stress and improve the symptoms of sickle cell disease. In a double-blind, multi-center Phase 3 trial, investigators randomized in a 2-to-1 ratio 230 patients who were 5 to 58 years old with a diagnosis of sickle cell anemia or sickle beta-0 thalassemia and who had 2 or more painful crises during the previous year to receive oral prescription-grade glutamine or placebo. 67% of patients were taking hydroxyurea at baseline. The primary outcome, the frequency of painful crises, was assessed at the end of 48 weeks of treatment. Patients in the glutamine group had significantly fewer painful crises than those in the placebo group, a median of 3 versus 4, and significantly fewer hospitalizations, a median of 2 versus 3. The rate of serious adverse events was higher in the placebo group, 87% versus 78%. Patients assigned to glutamine more frequently experienced nausea, non-cardiac chest pain, fatigue, and musculoskeletal pain. The authors conclude that oral glutamine reduced the incidence of painful crises in patients with sickle cell anemia. Full trial results are available at nejm.org.
Now going to the pros and cons, starting with the pros. We can tell that this is a randomized, placebo-controlled, double-blind trial which is necessary to avoid biased information. And the other ones is the patients with prothrombin time international normalized rating, which is the INR, higher than 2.0 were taken out of the trial because they might alter the results of the trial as they are prone to bleed more easily. Now, with the cons, the discontinuation was predictable in some patients because of withdrawal of consent from other reasons and non-adherence to the treatment. Now, another disadvantage is the necessity or the need to have an emergency group in case that the placebo group, which did not receive the medication, had like an episode of this sickle cell disease. Now, other thing is that the using l-glutamine has adverse effects, which include hyperesplenism, abdominal pain, dyspepsia, and hot flashes, which were the causes for 5 patients from the l-glutamine to retire from this trial.
Our phase 3 study was based on our understanding of redox potential in sickle red blood cells. In 80s, scientists have realized that oxidation plays a major part in pathophysiology of sickle cell disease. So my mentor, Dr. Zayas, tried to reduce this oxidation damage to red blood cells. In doing so, he looked at this particular molecule called NAD, because NAD is the antioxidant for hemoglobin, which is the main part of a sickle cell disease. So then Dr. Zayas and I looked into metabolism of NAD, and in our studies we realized that supplementation with the precursor of NAD, which is called l-glutamine, is going to reduce this oxidation stress. And we hypothesized that reducing oxidation stress is going to reduce the damage to red blood cells, and eventually patients will have a better clinical status. So we moved on to phase 1 and phase 2 clinical trial, which have shown basically confirmatory data of our hypothesis, and we just completed the phase 3 clinical trial. Phase 3 clinical trial, for this we enrolled 230 patients from the sites in the United States, and involved 31 major sites. Most of them are university and medical centers. And we randomized the patients into l-glutamine or placebo, and we monitored them for 48 weeks. The patients were diagnosed with sickle cell disease or sickle beta 0 thalassemia, and the patients were 5 years and older. The results were really fascinating for us. Although we had expected this to improve condition of sickle cell disease, we actually got the result that was better than we had expected. We have seen the significant reduction in the frequency of sickle cell painful crisis by 25%, decrease in the frequency of hospitalization by 33%, decrease in duration of hospitalization by 41%, and decrease in one of the most devastating complication called acute chest syndrome by 58%. So in this, what we saw was what we call cascading changes. If you understand, yes, even if you're on l-glutamine, you may have crisis, although there is a less chance of having crisis because there is 25% reaction. But even if you have to have crisis, there is less chance of being hospitalized. And if you have to be hospitalized, there's a chance that you're going to stay there for shorter duration. And again, if they have to be hospitalized, there's less chance of going to ICU due to acute chest syndrome. So overall, what we saw was that evidence that it's not just reducing the frequency of crisis, but crisis itself is much milder.
No. Because the sickle cell disease affects primarily to African people with sub-Saharan ascendancy, Central Caribbean, Arabia Saudita, Indian, Greece, and Italy. And besides, the origin of this disease was in Africa, where in certain zones there's the prevalence of carriers, which goes between 20 and 40%. The Ecuador does not form part of this high percentage. It forms part of the smallest percentage of patients with sickle cell disease. However, the population of the patients in Ecuador with sickle cell disease do not have the access to this type of resource, and it is not an option, at least for like public, for like the as a treatment for public area, because of our economy, which is a huge barrier. And now, as a conclusion, among children and adults with sickle cell anemia, the median number of pain crises over 40 weeks was lower among those who received oral therapy with L-glutamine, administered alone or with hydroxyurea, than among those who received placebo with or without hydroxyurea. Thank you.